Hi, I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Dr. O, Faithfully Transforming Healthcare. CHS and its entities strive to be responsive to our community's health needs. Good Samaritan Hospital's newly expanded Pediatric Emergency Department, located in West Islip, is a perfect example of meeting even our youngest patients' needs. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health, providing you access to the care you need. Today, we are visiting Good Samaritan's new Pediatric Emergency Department, which was developed specifically for children and their loved ones. Good Samaritan's new Pediatric ED has the only Level 2 Pediatric Trauma Program and only Pediatric Intensive Care Unit on the South Shore of Suffolk County, providing 24-hour coverage by pediatric and trauma surgeons, intensivists, and specialists. To speak more about this and see the ED up close, we met with Dr. Rita Daniel, Vice Chair, Pediatric Emergency Medicine at Good Samaritan Hospital. Let's take a look. Dr. Daniel, how are you?
How are you?
We'll do an appropriate social greeting in times of COVID.
Thank you.
Thank you for having us here at Good Samaritan Hospital Emergency Room, where we're in the brand new triage area. Maybe you could share a little bit about how this is configured and how patients would safely be able to flow through to get the care they need.
Absolutely. The pediatric patients as well as the adult patients will come through this entrance when they are walk-in patients, and we have a safe distancing protocols in place. We have chairs marked, and we have a separate waiting room for the suspected COVID patients and the non-suspected patients, and they will be taken into the triage cubicle. And we have 3 triage cubicle areas. So we use all the precautions from the window where they screen the patients. They will be screening for traveling and any suspicious symptoms for COVID. And if they say yes, they will be placed in a separate area away from the patients who do not have any suspicion for COVID or any travel.
So again, immediately when they come in the door, they're triaged and separated, and you could see how everything is spread out to meet social distancing and safe infection control practice guidelines.
We use the safe infection control all the way through, and we have a separate seating, we have separate triage for them, and they'll be placed in a separate area.
And you know what's really great, as you look around the room, you don't see people on top of each other. You're really taking concerted effort to move people in quickly and get them into their spot.
Absolutely. We do have a process called a quick triage, which means we will ask few questions, just 5 questions, chief complaint, travel history, and any specific allergies, and they will be taken in the cubicle, and they will be quick triaged and taken to the treatment area.
That's really important for folks in the community to know, because you come to an emergency room to get seen right away. I'm an ED doc like you. We don't keep you in the waiting room, we move you right in.
Absolutely not. So every triage room is set to triage pediatrics or adult patient, and we have a pediatric scale, and the computer is in every room, and the vital sign machine. And they will be sitting, of course, pediatric patient with the family. And we also have the system in place that one caregiver can be with the family, child all the time.
All the time. And
All the
private,
time.
as you can see here. Doors can be closed, it's
It is
private.
closed, it's private, and then they don't go back there. It's a one-way traffic. Once they're triaged, they'll be taken through the back door to the treatment area. This is our brand new state-of-the-art pediatric emergency department.
Wonderful. And when did we open?
August 5th of 2020. This is our small waiting room, pediatric waiting room. Again, we have social distancing, we have child-friendly furniture. We also took into consideration, we have a phone charger for the family, and we
Wonderful.
have a coffee machine for them, and restrooms and everything. As you know, all the rooms are private.
That's really important. So as you go around the configuration of the room, and again, me being an emergency room doc, it's very important. You can see each room is private, doors closed, so private, if you will, pediatric emergency suites for each patient as they come in.
Absolutely. So they don't have to worry about any infection happening to their child from some other person. And they are very quiet, and it's a child-friendly atmosphere. We don't have to get exposed to the adult patients.
So that's important. So for pediatric patients, this is a completely separate, brand new state-of-the-art pediatric emergency room staffed by board-certified pediatric trained emergency providers.
Absolutely, absolutely. And also we have nursing which are specially trained to take care of the pediatric patients as well.
It's wonderful. It's a great advance for the community.
Thank you. That's what we did this because for the community and for the children we serve, we do have about 150,000 pediatric patients under the age of 21 in our community. So we thought we should do better for them.
And that's really important because when you think about it, I mean, there's a whole range of pediatric illnesses and things that we treat, but we're also at Good Samaritan here, a pediatric trauma center, correct?
Absolutely. We are a level 2 American College of Surgeons board certified trauma center. This is the only one in the south shore of the Long Island here in Suffolk.
Dr. Danny, maybe you could show us a room as an example.
Absolutely. So this is our private room, and we have a room set with the stretchers as well as cribs for small babies, and every room is set up with a monitoring monitor, and we have all the necessary equipments we need to take care of any pediatric patient in this room. De-stressing, we have telephones and the computers in every room. The TVs. Not only they have TV, I was told that you can even charge your phone on the TV.
Excellent.
And we have not only the glass doors, we have curtains for privacy. We close it when we have patients, and every room is well equipped, and staff and physicians and even family is very happy with the setup.
While the room, the pediatric ED is new, the care is not. You've been in the community providing pediatric emergency services for 22 years.
Absolutely. The department is not new, the physical structure is new. Otherwise, my staff, I am so happy to say, some of my physicians are with me ever since the beginning of this department, which is 22 years.
Well, it's great. I know the incredible high quality care you provide. I send so many colleagues their kids here, and they always come back with raving reviews. I want to thank you for your leadership. I want to thank your entire team for the incredible care you provide to our patients in the community in the new Pediatric ED Center. Thank you, Dr. Daniel. We need to take a break, but when we return, we'll be speaking with Gara Edelstein, Chief Nursing Officer, Catholic Health Services and Good Samaritan Hospital.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy, and refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
We are now joined by Gara Edelstein, Chief Nursing Officer at Catholic Health Services and Good Samaritan Hospital Medical Center. Welcome, Gara.
Hi.
So let's talk a little bit about the brand new state-of-the-art pediatric emergency room. What makes it special for pediatric patients opposed to where we were?
Well, first of all, I can tell you one of the main things is that obviously the children no longer have to be in the main part of the emergency department. Not only do they have a whole separate wing for themselves, but they don't even have to go through it to get to the emergency room. So when the moms and dads bring the children in, they get triaged and they get immediately sent down a separate hallway into their own pediatric emergency.
It's amazing. You guys have been leading in pediatric services for 22, 28 years in the community.
Yep.
Now you have a brand new state-of-the-art
Beautiful.
ED, so it's separate. You don't even have to be commingled in the main room.
Exactly. So they don't have to be with adults. You know, this is a very, very scary place for children and their parents and their grandparents, whoever is bringing them. So they don't have to do that. They go right into a separate area, private rooms, separated out. They don't even have to hear other children. You know, sometimes you get little kids, they're crying or whatever. Separate rooms with doors closed, beautiful environment, lots of colors. And basically, the main thing is pediatricians and nurses that are particularly skilled at taking care of those kids.
You're an amazing transformative leader in changing the culture of nursing here, and really the pediatric specialty care that our nurses provide is second to none.
Yeah.
Can you elaborate a little bit on that?
Sure. Well, one of the things I'm exceptionally proud of is the fact that close to 80% of our nurses in the whole entire building at Good Samaritan have their baccalaureate degrees. So these are very educated nurses. They have and particularly the pediatric emergency department nurses have not only their baccalaureate degree, they are skilled, they're certified in advanced life support, pediatric advanced life support, and trauma certification for pediatrics. So they can handle really, literally
Anything that comes in the
issue
door.
that comes in for those children.
It's amazing. So
Yeah.
incredible base education,
Yeah.
and then all of the clinical certifications on top of it.
Yeah, very, very proud of them. They are excellent nurses.
And they're so passionate about caring for the kids in the community. What's the feedback from them regarding the new space?
Now, these nurses have gotten the area to work in that they deserve because they have been working so hard with these kids for so long. We have some very, very experienced nurses here, but now they get to really be in their home where they have the place, the time. They have child life specialists there that work with the children on a developmental stage. They help move the children and care for them from the beginning, from when they first come in to whether they have to be admitted or can go home. So it's just a great environment, and it's also an opportunity for them to work closer with the pediatricians and the pediatric intensivists that we have down in the ER.
What would you just say, last closing question, to folks in the community about Good Samaritan, about its ED, both adult and pediatric, now versus the past?
We've made so many changes here at Good Samaritan's emergency department. Not just in the physical environment, which we've changed not only for children, but we've changed for adults as well. We have moved around the space in the ER, now that we have a pediatric area, to make it quieter, to make it an environment where the physicians and the nurses can sit with the patients and take better care of them, just because, you know, an ER is a very chaotic environment. So we've worked very, very hard at improving the patient's experience here in the ER. Separate areas for patients that may have psychological issues, separate areas for patients who have more physiological issues, separate areas for critical care, and separate areas for pediatrics. So I think what we've been able to do, and we've improved the triage area,
Yes.
We have a fast track area, we have an area for patients that just need to be waiting for their blood results and then can go home. So we've built in areas of the facility where we can kind of separate it out by diagnosis, and then the nurses and the physicians specific to that area can take care of those patients.
Well, I know, I live in the community. I get great feedback all the time. So I just want to thank you and thank the whole team for the great work that they do.
Thank you.
And thank you for being on the show today.
Thank you very much for having me.
We also met with Good Samaritan Hospital's pediatric surgeon, Dr. Vincy Jones, back in the pediatric ED. Let's take a look. Okay, so we're in an actual operating room here at Good Samaritan Hospital Medical Center. We're in the South Tower building here, which actually geographically sits right above the emergency room and CAT scan suite. So geographically, it makes care if, God forbid, you need to be in a state-of-the-art operating room like this. It makes it quick and efficient. And I'm here with Dr. Vincy Jones, our Pediatric Trauma Medical Director. Vincy, let's talk a little bit about pediatric trauma and what makes it different than adult trauma. You know, there's the saying, kids aren't just little adults, right? They're different. Their physiology is different, and we need specialists like you to provide their very best in care.
That's true, Dr. O. You nailed it. A child is not a miniature adult, and so we just cannot take what is true for adults, compress it, and apply it to a child and expect to get good outcomes. A child can be appropriately taken care of only by pediatric specialists, and so that is why we need a pediatric trauma center.
Share a little bit about your background for the viewers.
Yeah, so we are a pediatric level 2 trauma center, and before I joined Good Samaritan Hospital, I was a pediatric surgeon at the Children's Hospital of Pittsburgh, which is one of the largest children's hospitals in the world. And just in terms of numbers, we used to see between 1,500, 1,500 to 2,000 pediatric trauma admissions every year, which is far more than any hospital in New York. Yes. And so the vast pediatric trauma experience that we accumulated there, and which we gleaned from other centers around the world, was brought into effect here at Good Samaritan Hospital when we established the Pediatric Level 2 Center.
Let's give an example, though, for folks. So if you took a disease process or acute condition in adult, contrast that and compare that to the differences in management for the adult to the child.
Let's talk about the spleen. Okay. That's a very common organ that everyone knows. It's located under the left rib cage. Now, for a child to begin with, the spleen is more likely to be injured because the rib cage is shallow compared to an adult where the rib cage goes all around and protects the spleen much better. But if you do get a splenic injury, an injury to the spleen, the way you manage it in an adult is different from the way you manage it in a child. For an adult, if there is injury to the spleen and if there is bleeding from the spleen, the surgeon does not think twice about removing the spleen. However, for a child, the spleen has very important immunologic functions. And so we try to save the child and also save the spleen. And so the algorithms that we follow for a spleen injury in a child are quite different from the algorithms in an adult.
That's a great example. Why is this center so important for folks in the community? And I really want that to be a great take-home message for our community residents who we are here to serve, right? What makes this trauma center so important?
Purely because over the years, Good Samaritan Hospital has accumulated pediatric specialists and pediatric experience, which comes into play when we deliver pediatric trauma care. And so if you look at Good Samaritan Hospital, we host pediatric specialists from multiple departments. We have pediatricians and intensivists from the Department of Pediatrics. We have pediatric surgeons like myself from the Department of Surgery. We have pediatric anesthesiologists from the Department of Anesthesia. We have pediatric ER physicians from the emergency department. We have pediatric trained nurses and physician assistants and ancillary staff who are trained to take care of children. So the entire team comes together in a collaborative effort to deliver pediatric trauma care, and that is unique to this community. There is no other center on the South Shore which has the range and the breadth of pediatric expertise that Good Samaritan has.
For us as providers, it's a privilege to care for patients in the community, and the community is just so fortunate to have healthcare professionals such as yourself and your team here to care for our children.
Now, this is especially true for pediatric trauma because, we always talk of the golden hour for trauma, and so in the first hour, the things that you do or fail to do can make the difference between a good outcome and a bad outcome. And so if you have a children's hospital 30 to 40 minutes away, just getting to that place can end up with a delay of more than an hour, and that could be pretty critical for a child who's injured. So I think it is, I really commend CHS for providing this service and for supporting this service, and the community, I'm sure, is absolutely delighted. That
well, I mean, you nailed it, and they are. I live in the community. You really, what you said, hit home. And when it comes to trauma, and most times it's blunt, vehicular trauma, car accidents, things of that nature, time is critical. And the expertise of the team caring for the patient is vitally important. We have that here with you, your team. Thank you so much for the great care that you provide and for the service this service and team provides to the community.
My pleasure. Thank you very much.
Dr. Vincie Jones.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay. Just go to the site.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
Thanks to all our guests today. And now for my final thoughts on today's discussion. You know, when you have an emergency, it is so important that you choose wisely, the right location and the right care team. Good Samaritan Hospital's pediatric and adult trauma services are second to none. Level 2 certification from the American College of Surgeons, the only one on the South Shore of Long Island. Choose wisely, choose Good Samaritan. Now for advice on how to triage your life. My health tip and solution for today focuses on understanding SARS-CoV-2 infection risks. This is coronavirus. My goal is to bring you information that will help you live a healthier life. You know, with so many experts, it's hard to determine what's factual and what's not. I'd like to share with you the truth in medicine, with no spin, no marketing, just the simple truth, as well as some trusted sites of information you can reference from home. I hope you'll find this material beneficial, and I wish you a healthier, happier life. Now, more than ever, it's important to take care of your health and develop a strong immune system. The one source of truth I like to share comes from the Centers for Disease Control, or CDC, and can be referenced at www.cdc.gov. Today, I'm going to address SARS-CoV-2, or coronavirus, and its infection risks. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome, Coronavirus 2. It is the strain of coronavirus that causes the COVID-19 disease. Understanding infection risks, according to the CDC, the primary mode by which people are infected with SARS-CoV-2 is through exposure to respiratory droplets carrying the infectious virus. Respiratory droplets are produced during exhalation. For example, when someone is breathing, speaking, coughing, or sneezing. Available data indicates that SARS-CoV-2 has spread similar to other common respiratory viruses, primarily through respiratory droplet transmission within a short range, for example, less than 6 feet. There currently is no evidence of rapid spread to people far away or who enter a space hours after an infectious person was there. SARS-CoV-2 is a new virus, and we're still learning a lot about how it behaves. We know that a significant proportion of SARS-CoV-2 infections, actually between 40 and 45%, can occur without symptoms, and that infection can be spread by people showing no symptoms. This is what we call asymptomatic spread. Existing interventions to prevent the spread of SARS-CoV-2 appear sufficient to address transmission both through close contact and under the special circumstances favorable to potential airborne transmission. These include interventions such as social distancing, which really means keeping 6 feet of distance between people, using face coverings like masks in the community, hand hygiene, and surface cleaning and disinfection. Also, ventilation and avoidance of crowded indoor spaces also can be beneficial. These measures are especially relevant for enclosed spaces where circumstances can increase the concentration of suspended small droplets and particles carrying the infectious virus. Age is a strong risk factor for severe illness and complications. Among more than 44,000 confirmed cases, the case fatality rate was highest among older persons, unfortunately, over 85 years old, followed by those aged 65 to 84 years old. Prior stroke, diabetes, chronic lung disease, and chronic kidney disease also have all been associated with increased illness severity and adverse outcomes. Serious heart conditions, including heart failure, coronary artery disease, congenital heart disease, cardiomyopathies, and pulmonary hypertension may put people at higher risk for severe illness. People with hypertension may be at an increased risk as well and should continue to take their medications as prescribed. In order to keep yourself safe, it is important to listen to your body. You know, I say this all the time. You know your body the best. Listen to it. If you begin to develop signs and symptoms of potential SARS-CoV-2 infection, these can be things very general: low-grade fever, headaches, sore throat, cough, body aches. Do the right thing, both for yourself and for people in the community. Isolate yourself, call your physician, and get tested. Results can be back in under an hour, or most a few hours, which allows your team to begin treatment sooner, which means less risk of severe disease and potential need for hospitalization. It also protects others in the community. If everyone does their part, we can mitigate a severe second wave. And most importantly, get back to life as we once knew it sooner than later. For more health information, tune in to CHS Presents Dr. O, Faithfully Transforming Healthcare, airing on the Catholic Faith Network and CBS TV 55. To view recent episodes, go to cfntv.org or CHS's YouTube channel, where you can also watch Dr. O's health tips and solutions. And if you need a physician, please visit www.chsli.org or call 1-855-CHS-4500. If you'd like to know more about Good Samaritan's Pediatric ED and what they have to offer, or to make a gift in support of this or another program that is important to you, please do visit chsli.org. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please drop us an email at dro@chsli.org. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Dr. O, Faithfully Transforming Healthcare.